Hi, you guys. Welcome back for our daily practice questions. Now, really quickly, I wanted to show y'all that I'm just trying something new. If you look at the bottom right hand corner of this, I added day three. I'm going to try that for this year to kind of help you navigate which video you're on. You may not remember the number because as the days go by, it gets to be so many videos. But I know when my cover pages look so similar, it can be difficult when you're looking through all of the videos. So hopefully, you may be able to say, yeah, I listened to three the other day. I'm going to listen to, five, six, seven this week or whatever. However, you're going through it, or whenever you find this, or whatever, I hope that this can kind of help you to navigate a little bit easier. Y'all give me your feedback and tell me if that helps you. But I'm just trying to find different ways to make it a little bit easier to sort through as the videos get to be larger in numbers since we do them every day. And like I said, on the playlist, I have a lot of the study videos already categorized by the system or that specific diagnosis that I am covering. So hopefully that helps you. And then all of the daily questions under this specific playlist. So let's see how this works for this year. But for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, maintaining a 99% pass rate on all of my review courses and a 100% pass rate on my one on one sessions. I do have two more available slots starting next week for the 4 week one on one sessions. If you want to grab those slots, I do have two more availabilities to start the year off with those. And then y'all know my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis. So any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number one for today. Question number one states a 42-year-old male presents with a spontaneous nosebleed that started while he was at rest. He is not on any anticoags and has no significant medical history. Upon exam, you notice active bleeding from the anterior portion of the nasal septum. What is the most appropriate first step in managing this patient's nosebleed? Is it A, apply a nasal decongestant and instruct the patient to lean back? Is it B, pinch the nostrils together at the Kesselbeck plexus and have the patient to lean forward? C, apply an ice pack to the back of their neck? Or D, insert a nasal packing immediately? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is being asked of you. So here the stem of the question states, what is the most appropriate first step in managing this patient's nosebleed? And here, this is a prime example of when the STEM is telling you exactly what you need to know to answer this question. It's saying, what is that first step? What is the first treatment management that you would do for a patient with a nosebleed? Now, I would still tell you to go back and review the scenario just to be sure that there's not any specific uh, factors or anything included that may warrant or tell you that you may need to go a different fashion or not, so to speak. But this is a 42-year-old male, came in with a spontaneous nosebleed. He's not on anticoags, no significant medical history, but there is active bleeding from that anterior portion. Anterior is the key right there for you to know. So your best answer is B. You want to pinch the nostrils together at that Kesselbeck plexus, which is where is most vascular. There's a lot of vessels there. So we pinch right there at that like tip of the nose area and have them to lean forward. I know this is always something that we struggle with. Do you lean back or lean forward? Many years we are always tilting our head back, but by guidelines, you're supposed to tell them to lean forward so there's no aspiration, okay? All right, question number 2. A 32-year-old female presents with a 7-day history of facial pain, nasal congestion, and thick yellow-green nasal discharge. She reports a fever, fatigue, and worsening symptoms after an initial improvement. On physical exam, there is tenderness over the maxillary sinuses. What is the most likely diagnosis for this patient? Is it A, the influenza, B, acute sinusitis, C, pneumonia, or D, allergic rhinitis? Take a moment and tell me what you got in the comments, you guys. All right, so here the stem of the question states, what is the most likely diagnosis for this patient? So y'all know I always tell you if they're asking for a diagnosis, you need to run it back and look at the assessment findings, right? And then with those assessment findings, always pay attention to their age, their gender, and their ethnicity, as this can contribute to determining a diagnosis as well as treatment, okay? So here, this is a 32-year-old female. She's coming in with a 7-day history of facial pain, nasal congestion, yellow green nasal discharge, fever, fatigue, and worsening symptoms after she was having initial improvement. And then on exam, we do note there's tenderness over those maxillary sinuses. Y'all, this is classic presentation of B acute sinusitis, especially that maxillary sinus portion. All right, and lastly, question number 3. A 28-year-old male presents with a 10-day history of persistent sinus congestion, facial pressure, and purulent nasal discharge. He has a fever of 101 degrees and complains of worsening symptoms after initial improvement. He has no significant medical history and is not on any medication. What is the first line treatment for this patient's condition? Is it A, augmentin, B, azithromycin, C, oral corticosteroids, or D, intranasal corticosteroids? Take a moment and tell me what you got. All right, all right. So, stem of the question here states, what is the first line treatment for this patient's condition? All right, so you know what I tell you. They're asking for treatment. You got to run it back and look and see if the diagnosis has been provided. In the event that they have not provided you with a diagnosis, you need to take it back a step further and look at the assessment findings so that you can determine a diagnosis because we got to know what it is to treat it, right? So here, the diagnosis has not been provided, so we want to go back and look at this assessment findings with the chief complaint, how they're presenting, and what we note on exam. So this 28-year-old male presents with a 10-day history of persistent sinus congestion, facial pressure, and purulent nasal discharge. He has a fever of 101 degrees and worsening symptoms. So same as the last question, but a little bit different, right? So we can determine that this is sinusitis, right? But the key points you want to pay attention to let us know that this is bacterial sinusitis are a few things. A 10-day history, they tell you typically once it exceeds that 10-day period is most likely bacterial. Viral typically will run from between that 7 to 10-day period. Once you get 10 or greater, they say, most likely by guidelines that is bacterial in nature. The purulent nasal discharge, bacterial presentation, that fever of 101 degrees, bacterial in nature, right? So, we want to go with some antibiotic management as this is bacterial sinusitis. And the first line therapy for that is your augmentin. So, A is your best answer. All right, you guys. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Now, all of the things that I do offer are linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or any of the custom packages, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. And as I mentioned earlier in this video, I do have 2 remaining one-on-one custom plan 4-week slots available that will start next week. If that is something that you're looking forward to, go ahead and get yourself back on. Typically, these slots are best for someone who has been unsuccessful on boards within a close range, and you're just looking for guidance and restructuring so that you can fill those gaps, study, and go back and be successful on your exam. So if that is you, either call, text, or email me and let me know so that we can get you signed up for that as well. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.